You're still on your Feel Good Breakfast show right here on S3. And this morning, we're diving into a topic that doesn't get a lot of spotlight, but my friend deserves to be spoken about over and over again. I'm talking about sexual wellness. And this morning, to help us understand what exactly it is, as well as how we can look after ourselves best when it comes to it, we got two beautiful ladies that are going to be letting us in on it. I'm talking about the CEO of Phytoceutics. It is none other than Laura Johnston, as well as none other than Mpume Zenda, who is a gynaecologist, obstetrician, and sexologist. For anyone out there who possibly doesn't even know what a sexologist is, can you give us a little bit of information about it?
Right, so I am a clinical sexologist. That means that I look after anything related to sexual well-being, and this could be dealing with either dysfunctions or challenges in the bedroom or sexual well-being. The gynae side of me generally takes care of the health side, which, you know, when we think about sexual health, STIs and you know, obstetric side, pregnancy and so on. But the actual nobody wants to talk about, and that's where I come in.
I love that you call it the yum.
Yeah, it's nice, it's pleasurable, and I think that's where it starts in us just acknowledging that we all love it, enjoy it, and when it's not going right, it's not a good thing.
Ish. And Laura, I mean, as someone who's not just a CEO, but also an integrative nutritional health coach, you work with people all the time. Do you find that more and more people are using sexologists?
So I think people are becoming increasingly open about their health conditions, whether it's sexual health or any other kind of health condition.
Yes.
And I do think it's starting to facilitate more open conversations. I think there aren't enough sexologists, actually, and I do encourage people to open these conversations both at home and with professionals.
So let's jump into it, please, Mpume, because I feel like there's a difference that we sometimes, you know, kind of mix up a bit as people, which is between sexual challenges as well as sexual dysfunction. What is the difference particularly?
A challenge is something that pretty much all of us, if you're sexually active, at some point, you're going to have some kind of a challenge. It could be anything from pain to just not feeling like it, which is like a low libido at the time, as long as it's not something that is consistent, lasting beyond like 6 months or so. To note, when it comes to pain, please do not wait until for 6 months before you kind of go and say, okay, maybe there's something wrong.
Yeah.
As soon as you have pain for however long, go see a professional. When it comes to a dysfunction, on the other hand, generally what we look at is the duration. This must have been a condition that is consistently present for at least 6 months.
And a lot of sexual challenges come from this emotional connection to sex. And any kind of psychological issue can impact your libido and your function. So making sure that you are mentally okay is important. Now, we have a probiotic that's clinically studied to improve this gut-brain axis. So basically, a lot of your emotions are derived between this relationship between the gut and the brain. So by fostering a healthy gut environment, you're managing things like mood disorders, stress, anxiety, and you know that can cause disrupt in your sexual function. Then also things like saffron. We've got a product called Felix. Saffron has been shown in studies to be as effective as SSRIs for depression. You know, if you're depressed and you're not feeling good, you're not going to feel like sex. And then there's also things like ashwagandha, which is an adaptogen. So it's an adaptogenic herb. It allows your body to adapt to stress, and it also has been shown in some studies to increase testosterone in men.
Oh, hectic. I actually didn't know that about ashwagandha.
Yeah, so women I'm nervous of saying, because women, as soon as you say increased testosterone in women, they think hair, muscles, you know. But absolutely, there is testosterone in women which does actually affect your libido.
Please speak to me, Mpume, just about some of the myths that you've heard of. What are the things you want to bust today for us that we believe but actually aren't true at all?
One of the big ones I would like to start off when it comes to women, we often assume that having penetrative intercourse is what will give you an orgasm or climax. And actually, for the most part, 80% of women need both clitoral stimulation as well as maybe penetration. The other one, women get pissed off on this one. Why do men fall asleep immediately after they've come? And actually, there's actually hormones that cause him to literally go into what we call a refractory period. The older they are, the longer that takes. The other big one is the assumption that men, I always describe it more like microwaves, you know. They kind of are stimulated visually a lot of the times, or with something that they're thinking. They'll see you walking past and they'll be like, yo, baby, let's go. For women, absolutely not, for the most part. A lot of the times, we need a lot of foreplay, at least anything between like 12 minutes or so. So this helps when you understand how your body is wired, because then you can, one, advocate for yourself during sexual intimacy, but also it's that element of understanding your partner so that you are not necessarily caught off guard and thinking he's just here for his own thing. I think the last one, which probably more speaks to the medical side of things, women go through a lot of cyclical changes within the month itself, if you're still in your reproductive phase, or even if you're just still perimenopausal and you have a period but not necessarily wanting to have more babies, is that you will not want the same kind of sexual intimacy at every part of your cycle. A lot of the times it's during your ovulation that you're up and about and you want to be on top of your work, your everything, and him as well, or her, you know. But it's totally okay going through that premenstrual phase. You kind of feel a little bit more sore. So when you understand these things about your bodies, the changes that happen because of the hormonal changes, it's so important.
I like the way that you use the word understand over and over again, because I think that's what it's about. It's about understanding, because even the things that you explained, there's an actual reason for it. You know, how important is it actually to have conversations with your partner around sexual wellness and beyond? And why is it that people actually should take those steps in doing so?
Sexual well-being forms an integral part of yourself, your well-being, but also of the relationship. We are still considered a very conservative society. And so it's difficult for a lot of people, not just to start the topic, but also just the how, the content of what you are talking about. The best thing I advise is, on the one hand, be willing to invest in talking about sex with your partner before, during, and after. And when you find that you're missing each other, you're not kind of getting to the bottom of what's going on, it is okay to also get in touch with the healthcare provider. It could be a sexologist, it could be a psychologist, because I always say the biggest sex organ is the brain. Get professional help.
Well, ladies, thank you for being the professionals that we can speak to and for making it a safe space. We appreciate it. And do remember, if you're someone who needs more information and even to find out about those supplements that are able to help with sexual wellness, you can head on over to Phytoceutics.com. I hope that today is a step for you in the right direction in having those uncomfortable conversations. No matter how it feels, it's all about making sure that it is 100% the best way that you can go about it. You're still on your Feel Good Breakfast show. Make sure you don't go anywhere.
Optimize your gut health with Phytoceutics range of pre, pro, and postbiotics. Use code EXPRESSO for 15% off at Phytoceutics.com.